Good morning, or good afternoon, I should say, and welcome to the TPEA conversation, our lunch and learn today. We're talking about emergency medical transportation issues in the state of Texas. We're also going to talk about the latest spring break discounts that are available to you as TPEA members through the Passport program. We'll talk about that at the end of our conversation today. My name is John Green with Association Member Benefits Advisors, and I'm joined by my co-host, Deanna Bauckham, who is one of our leaders in the Austin and South Texas area. Also joined by Executive Director Ann, by Ann and Ray with TPEA. And so glad to see those two folks joining us today. So we're excited about what's going on. They're going to share with us a little bit about what's taking place in the primary section of the time and the early voting and what's going on with that as well. So we're going to jump in here in just a moment. Just a quick reminder, all participants are in a listen only mode. And that means that if you have a question, feel free to drop it into chat or Q&A. And depending on if it pertains to which subject, either Deanna will answer it or Ray and Ann will answer that question as well. Or we can stop at the end of the conversation. At the end of our conversation today, stop recording and we'll just go to a live Q&A session if we want to talk about those things as well. So let's go ahead and get jumped on in here. And Ann Bishop and Ray Amell with TPEA. Before we kind of turn over to them, just a quick reminder, TPEA is constantly working on your behalf, protecting that pension that you're working so hard for. We've got some retirees who are on the call or semi-retirees who are collecting their pension as well. So they're protecting that pension out there and looking out for your benefits, the state contributions, pay raises, also keeping you abreast of in this primary season, what those candidates for certain positions across the state that you as a member or a citizen of the state have the ability to vote on. So Ray, you want to share with us a little bit about what's going on with the primary season and some of the key dates to remember? Ray, how are you, sir?
Hello, John. I know it says I'm Hannah, but I thought we might get better audio with this computer. Charlotte lend me her computer because we've had some audio issues. So, but yes, thank you for bringing this before us. You see the calendar of the time to vote, and for those of you who haven't voted, do know that across the state, most of the state, and whether the weather is the factor or the fact that you had the president's holiday on Monday, Washington's birthday, President's Day on Monday, and there were no polls open. But whatever the reason, early voting has been much lower than usual. And I think that if you haven't voted yet, do vote on March 1st with added emphasis. I say that because your vote will count even more, and in your primary races especially. So please get out there and vote on March 1st. And know that in several races, there's a likelihood there will be a runoff. And you see on the calendar that John has put before you that the runoff election will be on May 24th. So you'll have a time between the election on March 1st and May 24th, and several local races around the state. You'll see you'll have runoffs. So that'll be typically, historically, turnout has been even lower in runoffs. So your vote will count even more. So I guess that's kind of where what I want to emphasize most today is that your chance, and as we've said, your opportunity to vote on who your bosses are, which legislators get elected is right before you, right here in the primaries, because most of the races across the state are going to be decided in the primary due to the way the state has apportioned its legislative districts, which are either primarily Republican or primarily Democrat. And so your primary is where you can make your vote count the most. So you really count.
Exactly. Ray, I have a question for you. I noticed if you go out to Facebook and you're looking at the TPEA Facebook, several candidates have weighed in on some topics that are important to TPEA.
John, that's a great segue to my next point,
okay,
which is that if you take the time to go to the TPEA website, you will see questionnaires that a slew of candidates have responded to that we put out asking them where they stand on the key state employee and retiree issues. And of course, that has to do with, do they support pay raises? What is their position on getting an annuity increase or 13th check to retirees? What is their position on the health benefits for state employees and retirees, and et cetera? So in addition to that, we have been able to interview several candidates and to kind of drill down a little bit with them. And those interviews, some of them at least, are on the TPEA website also. So try to look and see if you can identify, first of all, identify who your particular legislative candidates are in your particular Senate district and House district, and then look on the TPEA website, identify how they've responded to the questionnaires that we put out.
Great. Like I said, I love looking at those out there. And I think we posted here recently, or TPEA posted recently, a great article by the Texas Tribune. And Ann, I'm going to ask you this. Why do you think that early voting is so low this year when there's some pretty contested races out there?
Well, I think early voting, or voting in general, is low in Texas. That's not a surprise, or it's not unusual. In the primaries, 3% of the people decide who's going to be elected. And that's a shame, because that means the 97% of us are going to have to live with whoever those 3% elected. And I will say, I voted this morning, and there wasn't a line. It was really easy to go in and out, but it can be overwhelming with the number of races after a redistricting year. But please, please, please recognize that you don't have to vote in every race. If you don't know something about the candidates, or if you're uncomfortable, don't guess, because there are a lot of candidates who either have very common names or who have run for office many times, and so their name is familiar with to you, but are not necessarily the best candidates. And there are a lot of people who won't answer any questions, or who have no social media or no contact with the electorate. So please don't guess. You can go in and just vote for one race if you want to. And you don't always have to vote for, or you don't have to vote for the propositions. There are a number of propositions, and depending on which county you live in, you can choose to vote for those or against those propositions or not. But whatever you do vote for, your vote will count, because only 3% of the voters vote in a primary election. And I can't stress to you enough that these are the people, whoever is elected, are the people that will vote to give a pay raise to state employees or an annuity increase to retirees, or I should say. So having somebody that's friendly to our issues is very important. And that's why we took the time to ask the candidates those questions. And not everybody is friendly to having a state employee pay raise or annuity increase. With that said, I will say that most of the people who responded to the questionnaire are people who either had a lot of state employees in their districts, so they recognize state employees are a big population to vote, or people who are running in open districts. And an open district is a district that does not have an existing state senator or state representative running. They either retired, or they're running for a different office, or they chose not to run. So it means that somebody on that ballot is going to be your next state representative or senator. We don't know who, and in a lot of districts, there are a lot of people running for those open seats, but somebody is going to run and win. And we went out and tried to touch base with every single one of those people as our priority.
One example is up in the district that goes from Amarillo, wraps around down to Midland, Odessa, and Big Spring, Senate District 31, and the incumbent senator, Senator Seliger, is not running again. He's retiring. So that is what Ann is talking about. That's an open seat for a Senate race. And those of you in West Texas have a great opportunity to have an impact. And that also might be a race that would go into a runoff. And to double down on what Ann was saying, the turnout in runoffs is even less than 3% historically. So you have a chance to magnify the effect of your vote, especially, and this is one of our key points, in your circle of influence, your friends, your coworkers, your family. If you have sufficient influence on them, if you know that they'll vote the way you're asking them to vote, then you make sure they get to the polls, make sure they vote. And you can really magnify the effect of your vote that way, especially in a runoff situation.
Absolutely. And I think today, Ray, what we talked about is the last day for early voting, but aren't the polls open longer today as well? They've been the past couple of days.
Some of them are, John, it varies. You need to make sure you keep on top of that. But yeah, a lot of them are going to be open a little later.
Okay, great. Well, thank you very much. Again, if you've got questions about the candidates, about the races in your area, check out the TPEA website. There's so many different advocacy points out there. Again, those interviews, Facebook, lots of different resources. Again, you have the opportunity to vote, and your vote really does carry a lot more weight in these early primaries, and especially in the runoff because of the volume of voters. So thank you very much for taking care of us. Anything else that's out there on the docket pressing, Ann or Ray, that members need to know about?
Well, the pretty soon the directions to agencies will go out for the legislative appropriations process. That kind of it'll give them guidance, agencies guidance in submitting their budget requests going into the next biennium. But we'll be talking about that in the future.
Okay, super. Well, thank you very much for joining us and keeping us up to date on that. And again, we encourage you to get out and vote, because there is such an opportunity to take care of, vote for people who actually have impact on your particular job as well. So,
and John, just one more point here, and it's very important. I mentioned your sphere of influence as whether you're a retiree or employee, but if you have friends and coworkers who you think are interested in state employee and retiree issues, and you're talking to them about those, ask them to join TPEA. And here John's going to give you the different membership opportunities.
Absolutely. Joining TPEA, 650 new people joined TPEA last year. There could be state employees, retirees, or friends of TPEA. For active employees, it's $7.50 a month. For retirees and for associate members who maybe not be retirees, but they just want to support what TPEA does, be a family member that has a state employment, something like that, it's $2.50 a month. You can always find that if you go to the website, tpea.org, click on the link to go through that. AMBA representatives can help you get enrolled as well, become a member, get it taken care of, whether it's payroll deduct, whatever the situation. So we're glad to do that, want to continue to do that. This is an excellent time for us to have a stronger voice. The more TPEA members, the better we can support your message at the Capitol when it comes time for appropriations and when the legislative session goes back into effect early next year. Just a quick reminder, TPEA and AMBA together serve you in several different ways. One, they help provide you benefits that fill gaps that aren't covered from your state benefits. They're portable. If you leave state employment for whatever reason, retire, go to work in the private sector, come back, doesn't matter, you can take the benefits with you. You can extend them to your family members who have aged out of your state benefits. And we have a lot of state employees that extend their benefits to their family members who are their parents, because if their parents are properly taken care of, they don't have to worry about taking extended leave from their job to be able to take care of their parents. And so it changes their dynamic at home as well. So there's some benefits of having TPEA and AMBA together. We're going to talk about an ambulance issue today, about emergency transportation and what the solution that TPEA and AMBA have stepped up to provide. I'm going to ask Ann to provide a testimony on why she has this particular program, but we're going to talk about some of the costs and the look at trauma centers in the state of Texas. We're going to talk about this concept of a golden hour as well. And we're going to discuss some of the myths and realities of what insurance pays for, what Medicare, what your state benefits pay for, and how you have the most peace of mind in what the endorsed options that you have out there. And then we're going to, at the end of the conversation, talk about all the latest discounts for spring break, all the new things, the freebies, the benefits, and things like that. If you're planning any type of spring break activity with your kids or grandkids, there are a lot of new discounts out there. We're going to show you where to find them and take advantage and make your membership in TPEA even more valuable as we go forward here. So let's jump in and talk about the golden hour. This was a term coined by Dr. R. Adams Crowley, who is a surgeon in a teaching hospital up in the Northeast. We think it may have come, the initial concept of it, back in the World War I battlefields in France, but it's that hour immediately after some type of traumatic event in which, if you can get medical treatment, you can increase not only this chance of survival, but you can reverse some of that damage, that internal damage that may prevent any type of, or may cause some type of long-term health issue. And so Dr. R. Adams Crowley, he really coined this term several years ago. And as a result, hospitals and emergency services have tried to ramp up their response times and their response capabilities to maximize that golden hour and get treatment as quickly as possible. So as a result, you see more ambulance services, you see more air ambulance or life flight services, things like that, be it contracted private contractors, be it contracted with a hospital, be it county services, things like that. So you see this more to meet that golden hour issue out there. But the challenge that you have with that is you've got more people out there trying to maximize that golden hour. Well, the costs continue to rise because most of these services are not regulated. The federal government tries to put in some balanced billing regulations that try to keep these costs in line, but you can still see that a lot of these private companies, and even these ones that are contracted through a hospital, they get charged significant amount of money when there is some type of ambulance ride, whether it's just a few miles or whether it's a air ambulance flight for 100 miles. It doesn't matter. The challenge is in the state of Texas, according to the Texas Department of Insurance, 85% of all ground ambulance services and 60% of all air ambulance services are not part of any type of network. Doesn't matter whether it's a Medicare network, whether it's some type of state plan, HMOs, PPOs, does not matter. They choose to reside outside of that. So they're not responsible for keeping their costs in line. They're going to pass the additional cost over what medical insurance doesn't pay on to us as private citizens. And when you look at the usage of ambulance services, the more we age, the more likely we are to use ambulance services. Once you reach over age 65, women, close to 59% are the users of ambulance services out there. And the top 5 reasons we as adults need emergency services or emergency transportation, number 1 is heart attack or stroke, by far and away, even more so than accidents. And we always think about accidents, car accidents, things like that, as the reason why somebody has an ambulance ride. It's usually a heart attack or a stroke at home. Some type of neurological disorder, some confusion, something like that could cause that. With COVID, we saw the rise in emergency transportation because of respiratory distress. And where we really saw this from a transportation rise was maybe you took a parent in or a family member into a hospital, but their condition did not improve and they had to be transported to a more advanced hospital, a level 2 or a level 1 trauma hospital. That's where we saw some of those respiratory distress increases in emergency transportation need. And then falls. We hear about snow, ice, all that kind of stuff, especially up in the Metroplex. And you think about slip and falls. That's another one of the top 5 reasons why people need some type of emergency transportation. Well, then you back up this situation we have in Texas, and I'll show you a map here in just a moment. We have 4 different types of trauma centers whenever they're graded. Your level 1 trauma center is a trauma center that has usually the teaching hospital. They have specialists 24/7. They've got all of the equipment, all of those type of facilities and a broad array of services. the best of the best when you think about that. Then as you go down your trauma levels, your level 2s, 3s, and 4s, level 2s, still very, very good hospitals. They just don't have maybe as many specialists or some of the equipment in there. The 3s and 4s, they're really designed just to stabilize somebody and then get them to a level 2 or a level 1 trauma hospital. So some of these level 4s, think of a doc in the box. If you have something that you think is wrong or a broken arm, broken leg, you go there first, and then you get transferred somewhere else to get stabilized or have the surgery performed, things like that. The further we live away from these level 1 and 2 trauma centers, the more expensive sometimes that transportation cost becomes, because we have 2 trips. Oftentimes we have an emergency trip into the level 3 or 4 trauma center, and then an emergency trip on beyond that. And so you look at these miles and miles of Texas, and that map on the left are the districts in which they divide up the emergency services. Really just goes to show you how they classify the frontier counties versus the non-metropolitan and the metropolitan counties. And then you see this map on the right. There are counties, many, many counties all across the state that either don't have a level 2 or 3 trauma hospital, much less a level 1 or 2. So you've got that corridor, I-35 down from Dallas-Fort Worth all the way down to San Antonio, some over in the Houston Metroplex, and then in your scattered in Lubbock, as well as El Paso and Corpus Christi. You see that there's just not that many level 1 and level 2 trauma centers outside of the major metropolitan areas. And again, as I mentioned, what that means is oftentimes it's 2 transportation issues, 2 services, 2 additional costs that you may not be planning out there. And so people ask us all the time, and Deanna sees this all the time. Many of her clients ask her, and many retirees ask, why am I not covered by my insurance? Whether it's state insurance, whether it's private insurance, whatever, doesn't matter. Most policies have a usual and customary charges clause within their policy, which means that they will only reimburse or only pay the provider, whether they're in network or out of network, X fixed cost based on mileage, based on the type of transportation. Anything above that, and as we talked about, the number of out-of-network ambulance providers in the state of Texas is very, very high. Anything above that is responsibility of us as the patient out there. Then you jump in if you've got Medicare as primary. Medicare language is very tricky. They have a very tight fee schedule as well. If that provider charges more than that fee schedule, we're responsible for that difference out there. And then, and this is a situation that happened to me several years ago with my son, he was carted off of a football field, strapped down to a stretcher and couldn't move. But the insurance company determined that his ambulance ride to the hospital was not medically necessary. He could have been taken in a car or an Uber, something like that. So we were responsible for the whole $1,500. Same way with Medicare, same way with private policies. They can determine that you may or may not have needed that emergency transportation there. So what happens is, regardless of whether we have insurance, and the state provides you great insurance. I'm not trying to denigrate any of the state insurance that's offered it to you out there. We have an exposure as individuals, even with insurance. And even if you're on Medicare, what they do is they'll put in qualifying language. And I've highlighted a couple of qualifying languages pieces in there from their Medicare and You pamphlet from last year. They may pay for emergency transportation. Doesn't say that they will. They may pay for, even if the doctor says you've got to be transported to another hospital, subject to deductibles, co-pays, all that kind of stuff like that, or your supplement plan. So there are so many different limiting factors that insurance companies and Medicare will put on you to make sure that their costs are covered. Then you have an out-of-network provider, that cost gets passed on to us. And then what happens inside of the ambulance or the life flight is totally separate from the actual transportation itself. There are 2 types of life support if you're getting into an ambulance, be it air ambulance or ground ambulance. Your basic life support can be provided by an EMT, that's CPR, bandaging, splinting, checking your vital signs, things like that, just to get you somewhat stable in the transportation process. Usually, basic life support is covered by insurance, Medicare, not a problem. Your advanced life support, your paramedic level type support, especially when you're involved in an air ambulance situation, life flight situation, EKG monitoring, manual defibrillation, any type of needle chest compression, IV fluids, things like that. Those advanced life support, they will bill those things out separately and itemize those. Again, follows that usual and customary charges, regardless of what your provider pays for or for what the provider charges. Your insurance company follows that usual and customary. Medicare doesn't even pay for any type of advanced life support. Doesn't matter if you needed it or not, they don't pay for that. That's not part of what they cover in the transportation there. So just the ride to the hospital has a different experience than the actual what took place in the ambulance or the air ambulance out there as you go forward. And it really boils down to, you can't prevent bad things from happening. You can only be prepared when they do happen. And that's why TPEA and AMBA have stepped up to provide you some type of option. I want to show you some bills here first, so you can kind of get a grasp of how these ambulance bills come in, and then what happens from the insurance company perspective out there. Here's one that's 20 miles, not too far in Texas. I mean, 20 miles could just be the grocery store, as we know, in a lot of situations there. You see, just to dispatch the ambulance, it's about $1,300 in that top example. 20 miles, $420 on top of that, $1,700 total charge. The insurance company reimbursed or paid for $370 something expense out there, leaving the patient with a $1,300 bill. Down at the bottom, only 9 miles. And you see what the cost is out there. It ended up costing $1,000 to the patient, even after insurance paid about $460. So you can still see there's a significant amount of money. Even closer, so it doesn't matter if it's 9 miles, 90 miles, 4 miles, you see what the expense is out there. And then take a look at that bottom expense. This is a California example out here. $33,000 in a helicopter just to turn those rotors on, just to get that thing started. They only flew 25 miles. There's $7,400 for that. And then all of those life support mechanisms in there, all of what they had to do and the costs that were added in there. Now, Blue Cross Blue Shield's a good payer. They paid $33,000 towards that bill. That's great. However, that left the patient with $8,300 bill out there. So even the best benefits don't cover all expenses completely. And that's why the TPEA and AMBA have stepped up. And let me show you another example. This is one closer to home in Wichita Falls. This is Dr. Khan back in September of 2018. He was in an ATV accident and lost his arm. And so he was picked up at the hospital in Wichita Falls at United Regional Health, good hospital, and flown via helicopter down to John Peter Smith Hospital in Fort Worth. 108 miles was all that distance was. He was charged $56,000, and they were calling him 3 days while he was still in the hospital, call him, say, how you plan on paying for this? What are you going to do to pay for this? Blue Cross Blue Shield of Texas picked up picked up 12,000 of that, and he was left with a $44,000 expense for that 108-mile air transfer, which is not surprising in Texas. As you know, we've got miles and miles of the state, and a great situation to be in, unfortunately. Here's where TPEA and AMBA have stepped up with the MASA service. I'll talk to you a little bit more about what it does, but Medical Air Services Association is what it stands for. It's any ground ambulance, any air ambulance, anywhere in the world. Doesn't matter whether you're in Texas, downtown Austin, if you're out in Big Bend, or if you're in Florida, or if you're in Mexico, somewhere over in Europe. Doesn't matter, anywhere in the world, they will provide the service for you. MASA has been around for over 47 years. There are 2 million active members that are already enrolled in the MASA program. MASA enjoys a very good rating from the Better Business Bureau. They provide not only reimbursement at no dollar limits for any of your emergency transportation costs, but if you are in other parts of the world and have a medical issue, they've got paramedics, registered nurses, and physicians on their staff that can coordinate with your transportation needs. I'll show you a couple examples of how that works here in a moment, because having that professional staff behind you can also give you great peace of mind when you do travel. Here's an example of a client of ours up in Fort Worth, or actually in Azle, a suburb of Fort Worth. Husband was having a stroke, and it was during heavy traffic time. And to dispatch an ambulance out there would not have given him enough time in that golden hour to get treated. Possibly could have lost his life. So the hospital dispatched a helicopter, landed in the street out in front of his front yard, flew back just a few miles over to the hospital in Fort Worth. It was about a $25,000 bill. Massa paid 100% of that, took care of it 100%, didn't have to worry about any claim paperwork, knocked it out right there. It allowed her husband to recover, and they didn't have any financial distress on top of that from that situation. Here's another situation, a little bit more, I won't say exotic, but out of the state. This is from a retired teacher that was traveling down in Mexico, climbing up those pyramids that are down there in Mexico, and fell and broke her leg. Broke her leg so severely that the doctors in Mexico couldn't get it set properly, and she was in danger of losing her leg. She had Massa. She called Massa. Massa dispatched an airplane, a medical air flight, with doctors down there to take care of her and perform surgery in flight back to Colorado where she lived. It allowed her to keep her leg, to keep her mobility, and get back out on the road and traveling again. She had zero expense as a result of this. After 13 fractures, all of that care was taken care of for her and paid 100% by Massa. Now I'm going to ask Ann to step in here and tell the group, Ann, you're from that busy stretch between Austin and Brenham is kind of where you're from. So tell people why you have the Massa program.
Okay, John, thanks. Yes, as John said, I'm originally from Brenham, which is in between Houston and Austin. And I drive there. I still have family there, so I drive there quite often. And one of the things that I see constantly are wrecks on Highway 290. And one of the things that I know from living in that area is that when you have an accident, that you're either going to be taken to a local facility, which they're very good, but as John said, they're not level 1 trauma facilities. But ultimately, depending on the severity, you want to get to a level 1 trauma center. And when I'm traveling, it's either going to be Houston or Austin if I have some kind of accident. Well, I bought Massa, and actually my siblings as well, who are not state employees, joined TPEA to buy Massa as well, to have this coverage, so that in the event that we had an issue, whether it is a heart attack, a stroke, or a car wreck, or anything like that, that we would have the ability to have the transportation covered, whether it is in an ambulance or an air ambulance, and have the least amount of cost to us. Unfortunately, not too long after I did buy the Massa plan, I did have an accident on Highway 290 where somebody pulled out and hit me and sent me across the highway. Fortunately, though, nobody was severely injured, and we didn't have to call that, but I was certainly glad that I had the opportunity to have Massa and to not have to worry, at least, about that aspect of the accident.
Absolutely. Thank you very much, Ann. I appreciate that. For those of you like myself that travel from Houston and Austin back and forth, it's become a speedway now, even more so than it was before, because they've opened up so many more lanes, but there is a lot of traffic, a lot of small towns to roll through. So I appreciate your testimony on that, Ann. Just a quick reminder of what Massa does. Massa is not an insurance program. It is a membership program. It's a supplement to any type of health insurance coverage that you have, but it gives you that financial protection for all of that emergency transportation issues. No matter whether you are in Austin or near in home, traveling all across the great state of Texas, anywhere in the country, and anywhere in the world, it gives you peace of mind to know that you've got zero expense for emergency transportation. Those will be taken care of. And I'll kind of show you how that works as we go through here. Massa provides for you, when you become a member, emergency air transportation. I showed you some of those examples. Not only is it helicopter, but it's also air flights back from other countries or across the state. I mean, Texas is big as a lot of countries that way. It's ground ambulance, and that's where most of our members utilize the MASA reimbursement. Their membership is through ground ambulance there. Repatriation, bringing you back from somewhere back home. And I'll show you an example of that in a moment. Return transportation, escort transportation, non-injury, meaning that if, say, you and your husband are off somewhere on a trip and you become injured, they will pay for the non-injured person to come back home in some type of transportation. So you're down at Disney World with your grandkids and you have a heart attack or something like that. They will pay to escort your minor children or your grandkids back home as well. Vehicle return, if you can't drive your vehicle back. Mortal remain transportation. We've had members that have gone to a vacation down in Mexico. Husband passed away. MASA came and picked up the body and paid for it to be returned back home. So you've got coverage anywhere in the world beyond just Texas as well that this is provided for you for. Now, there are certain membership levels, and I'll show you in a moment. And I'm going to ask Deanna to kind of give a couple examples here in a moment of the different type of membership levels. But you have two membership levels that are a little bit more advanced out there, a 5-year membership and a lifetime membership. These memberships come with a benefit of an ID bracelet. And you can say, well, I don't want to wear an ID bracelet, but it's okay because you can take that little chip off there and put it on your Apple Watch or something else. But it allows you to have all of your information, your contact information, who your doctor is, who your next of family is, any allergies, any pre-existing conditions. And so that paramedics, if they see that, they scan it and they already know how to treat you, how to call ahead to the hospital, that type of thing. So it just gives you an advance on that golden hour to make sure things are ready, especially if you're overseas or something like that. It also gives them 24-hour access to MASA to be able to pull up your records as well. So it's a really a neat feature that comes to you free with your 5-year and your lifetime membership. So I want to show you this example because it is spring break. If you're like me, I went to Big Bend with my dad and with my kids and my brother several years ago. I didn't break my leg whenever we were walking out there, but if you did fall and break your leg, let's say you live in Austin and you're out there in Big Bend and you fall and break your leg and it's a severe break, you can't be transported out anything other than an ambulance and you have to go back to Alpine. So there's about 80 miles to Alpine. At Alpine, a hospital there, they basically get your leg splinted, maybe put you back into some sort of shape, but you've got to have surgery. So you helicopter, they life flight you to Odessa, Midland, Odessa to get taken care of. Once you get recovered, you still can't drive back. MASA will pay for your flight back home, and then they will pay for someone to drive your vehicle back. So that's 4 different situations that would be money out of your pocket. Even if insurance paid for some of those transportation, they're not going to pay for your car to come back. They're not going to pay to fly you back home as opposed to driving back home. $0 out of your pocket because MASA will cover all of those expenses. Again, at home, across Texas, across the country, or worldwide. So Deanna, you want to tell us a little bit about the special membership options that we have for TPEA members?
Yeah, so thank you, John. There are options such as, we call it rent or own, basically. So renting would mean, and I think this is what you're talking about, is that you would pay a monthly premium as long as you wanted to keep the MASA program in place. That monthly premium does not cover the medical ID bracelet, nor does it cover a few of the extra options, which would include a 24-hour nurses hotline, a translator, things like that if you're traveling out of the country on that particular part, or this is an enhanced amount. Let me put it like that. On a 5-year benefit, you can purchase 5 years. So basically you're paying for 4 and you get the 5th year for free. And that does include the medical ID bracelet. And if you do family coverage, it's 1 for each one of you, not for the children, but it is 1 for each adult. There's also the lifetime. You pay 1 time and you're covered for the rest of your life. That's the biggest savings there for you. And so you would have that one and you would never have to worry about it again. You'd always be covered. You also get the medical ID bracelet with that as well for each adult on the program.
Okay. And then individuals can go out in the public, and just general public can purchase this online through MASA. But for TPEA members, we offer a significant discount. Is that correct, Deanna?
Yes, we do. So if you wanted just online to purchase this program, I don't know the exact cost, but I think it's somewhere around $720 for the year for this particular program. And with TPEA, we've negotiated a much better price around $324 as an individual.
And we waive the membership fee because it is a
Yes, we
membership
do.
program. So because you're a member of TPEA, not only you get the discount, you waive the membership fee on top of that. And then as an exclusive just for TPEA members, there's no claim paperwork you've got to file, 24/7 support. All you do, if you get a bill from your provider, whoever was that ambulance provider out there, or you get the balance bill from your insurance company, you just send that in to MASA. MASA pays for that 100%. So here's a look at the options out here. You see you've got monthly pricing. The pricing up there in black is what you're going to find for if you're just a general public member going out to MASA and purchasing that. The blue pricing is the greatly reduced pricing that you can achieve through TPEA membership that's available to you from out there. Now, if you've got questions about that, I'm going to share with you in just a moment how you can get a hold of that. If you've got questions now about what's covered, drop it into chat, put it in the Q&A feature, and Deanna and I can answer those for you as well.
Hey, John.
Yes, sir.
John,
Yes.
I might ask you to expand just a little bit about what family coverage means. There's some folks who heard you talk about the spouse being covered, et cetera, but talk about what the family coverage means.
Okay, Deanna, you want to handle that one?
Yes. So family coverage would be immediate folks in the household. It's not a parent. It would be you, your spouse, and any children that you have that are under a certain age of 26, not married. And so they can be in college and not in your household, but they would be covered. So this is a really good program for anyone who's traveling to college, and you can make sure that your kids are covered. And it would also get you to your kids should there be an emergency for that.
Now, talk about I call it the grandparent feature on the 5-year and the lifetime. If a grandparent is traveling with minor grandchildren, what kind of coverage extends to them?
So it would it's not really, I don't think it's coverage for the children if they're hurt, but it would get a parent to the children, or it would fly the children home to the parents. Same thing for pets.
Okay, great. Thank you very much. Great question, Ray. Appreciate that. Again, if you've got other questions, drop it into chat or into Q&A. But right now, I do want to kind of pivot a little bit. We talked about spring break. We showed you Big Bend, which, we didn't do a great example of what fun you can have down in Big Bend. But I want to take a quick poll and talk about spring break real quick. So let me launch this poll for those on the call today, so you can help kind of guide the rest of our conversation here for the next 15 minutes or so. Tell me what your spring break plans are. Feel free to answer that question there. If you're staying, if you're traveling, going somewhere, or waiting through the summer, whatever you're going to do. If you'll answer that, it's totally anonymous. We'll give you about 15 seconds more to do that. Got good responses coming in here, and it'll kind of help drive our conversation here very shortly. So just a couple more seconds out there. And I'm going to end this poll in just a moment. All right, let me share the results here. So we've got a lot of folks that are waiting for the summer. They're going to stay local. We've got a few that are staying in Texas and a couple that are heading out of the state. So let me just kind of show you some of the new discounts that are out there, and then we'll come back and answer some of the MASA questions. Let's go ahead and answer that MASA question real quickly, Deanna, that popped up here.
Okay, let me look at it real quick.
Okay, someone asked about getting MASA coverage for her sister. So basically, if they weren't a TPEA member, how would they become a TPEA member? I think Ann said she got this for her sisters and stuff like that. What was the process that you went through, Ann?
Yes, it was my sister and my brother became TPEA associate members. So I sent them to the website. They submitted an application to become a TPEA associate member, which is $2.50 a month. And when they became an associate member, they were eligible for the discount that MASA offers and EMBA offers TPEA. So as a result of becoming a member of our organization, even though they're not state employees or retirees, at an associate level, they had access to this discount.
Great. Thank you very much. And I'll show you, because we've had some other folks ask about, can I sign up today, or do I have to sign up today? Can I sign up later? I'm going to show you how to contact us. Deanna and her team, no matter where you live in the state, would contact you and say, hey, here's the process. If you're not a TPA member, we would help you to become a member right away on the spot as well and get you taken care of in that regard. So we'll show you that in just a moment. Walk through some of the discounts. Now, this program is called the Passport Program. It is free to you as TPEA members. There's an activation code if you're not already out there using it on the website. I'll show you how to get that information here in just a moment. But it is dining, travel, shopping, experiences, tickets, all that kind of stuff like that. These are some of the latest examples of discounts that are out there for shopping, clothes, housewares, tons of new discounts. Where I'm most impressed are some of the hot deals and the local restaurants. For those of you who are in Austin, they are adding so many local restaurants to the Passport Program every week. There were too many to even put out here. There were so many. I encourage you to go out to the Passport website, take a look at that. Hot deals. Hot deals. I have not seen Apple put hot deals out in a long, long time, and they have not put them out on their iPhones like they're doing right now. For iPhone 13, the Apple Watch, you can save pretty good pricing out there through the Passport Program. HP for laptops, things like that as well. If you're a food or wine person, there's discounts, new discounts for wine subscriptions, steak subscriptions. This Meal Pal service, it's in one of only about, Austin is one of only about 5 cities across the country. It's like a subscription service that gives you significantly reduced meal prices at restaurants all around the city. And then you've got Austin Street Cafe was one out there. There's so many examples, as well as all across the state, of different restaurants that are now available through Passport that can save you a significant amount of money that are available to you out there. Now, for those of you that are traveling in state, you're looking to go back to the theme parks with the kids. I know it doesn't feel like a water park type of day today, but in a couple of weeks, we know in Texas, it will be up in the 80s and 90s probably during spring break. You can go out to tickets at work through the Passport site, and that's where you can get all of your passes to museums, theme parks, water parks, exhibits, museums, all kind of stuff like that. Those things are out there. Depending on the city you go to, different offers. You can get those through tickets at work through the website as well. So, and then if you're going out of state, if you're thinking about going to Vegas or going skiing or going down to Florida, tickets at work, they have tremendous discounts on hotels in Vegas and Florida, theme park tickets. Great Wolf Lodge up in Dallas has about a 30% off their rates. Extended Stay America, also the Wyndham chain has different discounts, rent car discounts. If you are an Airbnb type person, through the Passport Program, through Haven, HVN, is kind of the Airbnb equivalent. And you can rent some really neat homes out there as well. So there's some really cool things that you can do to save with your Passport Program. And I'll show you how to find out those discounts here in just a moment. Just a quick reminder before we wrap it up, we've got 2 really neat webinars coming up in March. We've got Jen coming back from TextSaver, and Jennifer Preston is going to share with us all about how to make your Texas Saver maximize for you. So if you're just starting your career with the state of Texas, or you've been around for a long time, or you already have a Texas Saver plan and you're retired, how to make the most out of it, what to watch for, especially in this volatile market, how to maximize some things if you're coming up close to retirement that can make your Texas Saver plan stretch even further for you. Then we'll end up the month with a protecting your nest egg conversation, because if you're like me, I check the stock market all the time, see how my 401k or my Texas Saver equivalent's doing, and I don't like seeing red. How do I protect my nest egg? And we'll share the 5 top threats to your nest egg, what you can do about it, and in that informative conversation that we have as well. So always be on the lookout. You do a phenomenal job, and when you register, go out and look at tpea.org. Also look for the emails that Hannah sends to you. And don't forget to tell your friends about these webinars. We have so many people who are not TPEA members that were introduced to the TPEA through these webinars and became members. It helps us grow. It helps that 650 that came in last year, helps us grow even more. Get several thousand new members in here it makes Ray and Ann's job up at the Capitol even that more substantial when we've got that many people behind us out there. So I'm going to open it up for questions. There are multiple ways that you can ask questions in here. If you have a question, feel free to raise your hand and we can recognize you that way. Type it into chat, put it into Q&A. If you want to find out more about the MASA program, I'm going to recommend two things to you. Or actually two ways to get a hold of me. If you have your smartphone with you, open up your camera feature, hover over that QR code, and a little form will pop up and you can select MASA on there, fill out your information. It'll come back to me within 5 minutes. Someone can get a hold of you to take care of it that way. If you want to find out about the passport program, the discounts that we talked about and get the activation code, do the exact same thing, hover over that QR code and select benefit review. And someone can call and give you your activation code. If you're on a tablet or if you're on your phone and you can't access the QR code, feel free to type in my email, send me an email, john.green@amba.info. And I'll leave this up and be glad to do that for you as well. Okay. All right. Any questions that have come up out there? I know we've answered some of them online. If you've got a question, I'm going to stop recording here.